Hi, I'm Betsy Nicoletti. Thanks for joining me today. We're going to ask and answer a question. Can I get paid if my nurse does ear lavage for cerumen removal? And these codes haven't changed recently, but sometimes I still get questions about them and there's some confusion. So there are two codes. CPT codes owned and operated by the American Medical Association. 69209, removal of impacted cerumen using irrigation or lavage, unilateral. We'll come back to that. It's a service that's performed by a clinical staff member, and it has no work RVUs assigned to it. Whereas 69210, removal impacted cerumen requiring instrumentation, unilateral, that service, that code, does have work RVUs because it's work that is performed by a physician or non-physician practitioner, an NP or a PA, with instrumentation. You can't bill both of them in the same day. So if the nurse goes in and using lavage tries to remove the impacted cerumen but isn't successful, and so the practitioner themselves goes in after and using a microscope and an instrument, a curette, removes the impacted cerumen, we're going to bill just 69210. You can't bill for both on the same day. And although CPT has defined these as unilateral codes so that you should get paid 150% when you do them bilaterally, Medicare does not pay them as bilateral codes. Now, in order to perform this service, you need medical necessity, and it's any one of these four criteria meets the medical necessity. So we would be looking for that in the physical exam, and sometimes because there are symptoms in the HPI. So the first is visual considerations. The cerumen impairs exam of clinically significant portions of the external auditory canal, tympanic membrane, or middle ear condition. Qualitative considerations, it's extremely hard, dry, or irritative, and it causes symptoms such as pain, itching, or hearing loss. So in that case, we would expect to see something documented in the HPI. The patient says it's itchy, it's painful, and something in the physical exam. It's, hard, the practitioner sees it. Obviously, if it's impacted and we're going to try and take it out, you've got to see it. Inflammatory considerations associated with a foul odor, infection, or dermatitis, and quantitative considerations, so obstructive, copious cerumen that can't be removed without magnification and instrumentation requiring physician skills. So one of these four criteria has to be documented in the medical record to show the medical necessity for cerumen removal, whether it is being done by a clinical staff member or the practitioner themselves. It may be billed on the same day as an E&M service when it meets the description of a significant separate service. So since March of 2023, when the AMA revised and added to the detail about what constitute a significant separate E&M service, it's a little bit harder to get there. If you haven't seen that, certainly on our website, you can look for it there, or you can just Google CPT assistant, modifier 25, March 2023, and the document comes right up. And it has a list of criteria of what is considered pre and post work that's part of the procedure and isn't separately reported. Now, if the patient calls up and says, every few months I need to get this earwax cleaned out and I need it right now, and so the reason for the visit is cerumen removal, obviously we're not going to bill any now. So can you get paid for ear lavage if your nurse removes impacted cerumen? Yes, you can. But it needs to be medically necessary. So make sure you're documenting one of those criteria. The physical exam should show that. It shouldn't be a normal physical exam of the ear if we're going to do cerumen removal. And if it's removed so if the nurse does it, we use the 69209 code. If the physician or NPP does it, the non-physician practitioner, we use the 69210, and those can't be billed on the same calendar day. So thanks very much for joining us. There are a lot more resources on codingintel.com. So if you haven't spent a little time, a little of your, spare time taking a look at the table of contents, I invite you to do that now. Thanks very much.